Hi, and welcome to Dyadic Therapy via Telehealth with UC Davis. My name is Brandi Hawk. I'm one of the lead trainers for PCIT and PC Care at UC Davis. Today we're talking about how to prepare yourself and your families to transition to dyadic therapy. This might include parent-child interaction therapy, parent-child care, or family mealtime coaching. So first up, we need to set you up as the provider. That involves both setting up your equipment and your space. Thinking about your equipment, you want to use your laptop rather than a phone. Your laptop gives you more options with your telehealth programming, including the option to share content. Typically, when we use our phone for telehealth, we cannot share information over the screen with the caregiver, and so it's just so much nicer to use your laptop. It gives you more options. Make sure that you test your camera and microphone prior to starting the call. You want to make sure that your voice is heard and that you look presentable and that the caregiver is going to see you and hear you the way that you want. Then practice screen sharing. Screen sharing is so important for our dyadic therapies. We need to review measures and we need to review paperwork with our caregivers and clients. So it's important that we're able to look at those together, just like we would with the paper copy in the clinic. Here's an example for how to screen share. I'm showing you via Zoom because that's the web-based platform that we typically use for telehealth. Other platforms might be slightly different, but they should all be relatively similar. You'll see at the bottom of my screen, this is the bottom of a Zoom screen. You have mute next to it, and that little caret next to mute, you can choose the option test speaker and microphone, which is a great way to make sure that you can hear and that you can be heard when you start your call. Here in the middle, there's a little green button that says share. This is how you share your screen. You'll click on this share button, and then the screen that's in my little pink box will show up. This screen allows you to choose which screen you want to share with your client. Now it's easy to think, I'll just share my whole screen. But remember, if you do that, then anything in the background is also going to be visible, including any of your contacts or emails that might pop up during the session. So instead, make sure to just share what you want to present. Typically, that's a Word or PDF document. Here in front of my face, you can see pictures of adorable puppies. This is the screen that I'm sharing with you. This is just my Outlook, or just my Google Chrome page. And you can see up at the top now, mute and video is at the top of the screen rather than the bottom. And there's a little red dot that says stop share. That's all you need to press in order to take that share screen away. But this ensures that you are sharing just what you want with the caregiver and child and that you're able to review them together. Up next, not only do you need good equipment, but you need to make sure that you look good and that you're ready and excited for your session as well. Part of that is setting up your space. So we want to have a nice background that's either plain or has maybe a piece of art in it, but we don't want a cluttered background that's overwhelming to look at. And you don't want to show parts of your home that you don't want the caregiver and client to see. And you also want to make sure that there's no lights behind you. Lights either from a lamp or from a window can distract from you and can be very distracting for the caregiver and child when they're looking at your screen. Think about your lighting. While you don't want lights behind you, you definitely want lights behind your camera. That's going to help you become more visible for the caregiver and child. Having a nice lamp close by is also going to add a little bit of warmth to your face. You also want to think about what you're wearing. You are, for all intents and purposes, going in home with a client. So make sure that you're wearing something that you would wear to go into a clinic or go into the client's home. We also want to think about our peripheral sound. You have other people in your home, kids, other partners. Are there animals outside or inside? Is there construction going on? All of those sounds can be distracting for a caregiver and child during dyadic therapy. One easy way to protect against that peripheral noise is by wearing a headphone when you coach. If you do that, then the caregiver and child are primarily just going to hear your voice, and it will reduce the impact of the peripheral sound. You also want to think, if you are wearing headphones, about whether you need to record the session. That is the one reason that you as a provider don't want to wear headphones. If you are recording the session for some purpose, then you should not wear headphones because the recorder on your computer will only record what it can hear. And if you're wearing headphones, it won't hear the caregiver and child. All right, so you're set up. Now what about the family? We want to make sure that they are prepared for success. So before we get started in our dyadic therapy, we want to have one session where we just practice Zoom or whatever web-based platform you're using so that they are ready to go on your first session. So first up, location. Where should they sit or stand or play for your treatment? So we want to find a space that's as big as possible, where they can be face to face or engaged together, and where the camera can be far enough away that you can see as much space as possible. Because what's important is that we want to be able to see the child and caregiver interacting and see the child if they get up and move, because kids move. It's hard for them to stay in one place for the whole time. There's a couple really common places that kids and parents are going to be. First up, they might be at a table. So you can see in this picture that the parent and child are next to each other on the other side of the table from the camera. We've moved the chairs away from the table on the side where the camera is so that the camera's view is as big and uninhibited as possible. You can also notice that the camera is not on the table. If the camera is on the same table where your caregiver and child are playing, it really reduces the amount of space you can see. And then if the child gets up and moves to the side or anywhere around the table, you won't see them. So if possible, you want to move the camera back on a countertop or some other ledge so that you can see more of the table and the parent and child. Another common place to sit is on the couch. So you might have a parent-child sit on the couch. And again, you want that camera to be far enough away that you can see a wide space. In this picture, the child might get up and walk around the couch or move forward and play on the floor, and that would all be caught on camera. Next, we want to think about the floor. A lot of times for telehealth, our parents and children are going to sit on the floor. And so just like with the couch and the table, we want to be able to see as much of that space as possible. Usually, if a caregiver and child are on the floor, you want the camera to be up higher than them and then facing down on the parent and child. Here, we put the camera on top of the TV stand. So the camera is up on top of the TV stand, looking down on the ground, and we can see the parent and child for a pretty large space. The other thing that we want to think about is sound. So you want to make sure that that camera is far enough away that you can see a large space, but also close enough that you can hear the caregiver and child well. So check for sound. And then check for how you're going to talk to the parent and child. So obviously in the beginning, you're going to speak through their phone or computer because you want to talk to the parent and the child together. However, once you start coding and coaching, you want to think about how you want the caregiver to hear you. If you're used to working in clinic behind a mirror, you might ask the parent if they have a Bluetooth headset. If they do have Bluetooth, then they can wear one piece in their ear and you can coach them over that. It's exactly like the clinic because the child doesn't hear you and you're not impeding the caregiver's ability to play with the child. If you are using the headset, just turn your screen black, so take your video off, and it'll be just like you're behind the window. If you're used to doing in-room coaching, or if the caregiver does not have a Bluetooth headphone, then just coach in-room. So you would just speak right through the camera or the phone, just like you would for in-room coaching. Just remember that the child can hear you, so make sure that everything that you say is important and something that you're okay with the child hearing. And then we want to set our kids up for success. This is their house where they often are in charge, and we want to make sure that they know that you are there to support them, and we want to build them up to want to engage in therapy sessions. So one way of doing that is being very open. Be open about where you are and where they are, make light of it, talk about things and how this is so silly, but also great because you get to see them and their parent in home, and that you get to help them learn how to play together. And then set expectations. We want you to be the one to set the rules for the child and the expectation that they stay in front of the camera. This is important, especially in the beginning of services, because our goal in services is to improve the caregiver-child relationship, and we don't want the first thing that the caregiver does to be setting a rule about where the child can and can't go, setting up that power struggle right from the beginning. Instead, it can be your job as the therapist that you're working with the child to make sure that playtime is as good as possible, and that involves the child staying within the visible camera. All right, so you're prepared, they're prepared, let's get going. If we step into coding, you can do it. It's a little different, it feels scary, but really it's not all that much different than in-clinic or in-room coding. The important thing is we need to choose toys. So you want the caregiver to think about toys that are going to be effective for playtime and that don't make a lot of noise. So really, noise is going to impact your telehealth services. So we don't want loud noise-making toys. So help the caregiver think about it in advance and choose good toys. If they're going to be in a space that's secluded, that they can choose 3 toys and bring with them and the child can't go get more, great, then choose 3 toys. If they're going to be doing services in the playroom, it's not worth adding the power struggle in the beginning of session to say that the child can only choose between 3 toys. Let them pick whatever they want in the beginning. As we move forward in treatment, we'll have the parent put up some more rules and work on their commands so that the child chooses the toy that they want. Think about your sound. Can you hear them well? Practice the child talking, practice the caregiver talking, and visibility like we already discussed. And then prepare, prepare, prepare. Just like we prepare in clinic and in home, it is crucial for you to prepare the caregiver and child for silence, that you are going to give instructions and then be completely silent and not respond to them, especially after cleanup. So you want to make sure that they know exactly what's happening. And then when you are actively coding, mute yourself and turn your video off. That really reinforces the fact that you're not going to respond to them and helps you take on that observer coding role. And then last up is coaching. Coaching is really similar. It's not all that different at all, but the most important thing we need to do is set up expectations. For you as a provider, the expectation is you're still going to coach. You can still use all 3 levels of coaching without any problem. Just make sure that if you're coaching in room, that you know that you're comfortable with the child hearing everything that you say. So think about, are you coaching from behind a mirror via Bluetooth or in room with just the camera and video? And then look for timing, look for the child's cues. Your coaching might be a little bit shorter because you're in home and you want to make sure that it's a successful telehealth appointment. And so check the child's cues. If they're actually getting tired and they're just done playing, that's a good time for you to stop coaching. If they're just whining or want to do something different, you can help the parent try to redirect and use all of their skills to bring the child back into play. But just know that you have to be flexible and that sometimes time may be a little bit shorter. And you just want to make sure that the parent is recognizing what their child needs. But in the end, coaching via telehealth is actually pretty cool because it's way more generalizable than in the clinic. So if you are working on practicing meal times, you can do it at their actual table. A lot of our caregivers are worried right now about homeschooling and the fact that they don't know how. So you can actively help them with that in home via telehealth. So you are helping caregivers and children learn to use the skills that they need exactly where they need them. It just takes a little bit of flexibility and fun on your end to make coaching as effective as possible. So in the end, dyadic therapy via telehealth is not all that different than dyadic therapy in clinic or in home. It just takes a little flexibility, creativity, and a whole lot of preparation. Thank you.